Welcome back to the second session of the symposium today. The next speaker I'd like to introduce is Professor Elaine YUEN. Professor YUEN is the Associate Professor in the Department of Wisdom Traditions at Naropa University in the States. She is ordained as the Buddhist minister within the Shambhala Buddhist tradition. She is the program lead for the Master of Divinity program, which supports students to develop a pastoral and theological identity. She also teaches Buddhist meditation courses where students learn to join their academic studies with mindfulness and awareness. The topic of her presentation today is Hearing the Cries of the World, Buddhist Chaplaincy in the 21st Century. So please give a big round of applause to welcome Professor YUEN.
Thank you so much. I'm very happy to be here. We came a long way, obviously, and it's great to be in Hong Kong. I've never been here, but my mother did her nurse's training up at Queen Mary, so I feel an ancestral relationship to Hong Kong. What I'm going to talk about is chaplaincy. It's a little bit of a different topic than what we've been talking about today, or this few days. But as you see, there's many similarities and relationships with how we've been talking about mindfulness, compassion, suffering, how to address suffering in the world. So let's see. Okay. So I just wanted to start with sort of the motivation, a few words about the inspiration of the Buddha. I feel the Buddha, when he attained enlightenment, and in some places we actually...
You can push on this and you don't need to come.
Oh, thank you.
You can push it and work.
Okay, great. This?
No, second one.
This?
This one, yeah.
Okay, great. Okay, thanks. Okay, all my technology friends are here. Oh, okay. Oh, thank you so much. As we know, when the Buddha achieved enlightenment, he touched the earth. And actually, the celebration of his enlightenment was just the other day, on Friday, in some of our traditions. We celebrated Bodhi Day. We call it Bodhi Day in my tradition, and it's the day that he achieved enlightenment by touching the earth. And what I really want to say, because people have talked extensively about the Four Noble Truths and suffering, is that simply he touched the earth, and I feel in terms of following his example, someone who aspires to follow the example, walk in the footsteps of someone like the Buddha, that just as he touched the earth in his time, 2,500 years ago, I think the theme of this conference has been, how do we touch the earth? How do we, as Buddhist practitioners or people who are familiar with Buddhism, touch this earth of the 21st century? This earth with many difficulties that we've covered, this earth with the internet, this earth with many traffic problems, things like that. How do we actually touch the earth? Physically, spiritually, emotionally. So that is kind of how I think of what we've been talking about. We've talked a lot about the suffering of the earth, and I'm sure we will cover that more, but that is the question that is actually, the motivation for the work of what I consider Buddhist chaplaincy. So the other motivation besides touching the earth is this firm belief that I have. One of the teachings is the teaching of Tathagata Garbha, or that we have the seed of Buddhahood within us, or Garbha being seed or womb. And my analogy is that I'm a very bad gardener. So sometimes the seeds that we have are very small, and sometimes we cannot even find the seed. We lose track of the seed. So similarly, the seed of our Buddhahood, and we've talked about this in terms of the converse today and yesterday of suffering. We experience suffering, but the converse is that we may experience this suffering because we have not connected with the seed of our own Buddha nature, our own Buddhahood. So to me, the analogy of the seed of Buddha, of how we could grow, quote, grow this seed, is that it is actually composted by the manure of our experience. So we know manure is very smelly, difficult, and I think that is what we've been talking about in terms of counseling and touching the earth, is that we have the experience of the difficulties of our world, what my teacher used to call the juiciness of our world, which includes the joy, the passion, the compassion, all of those different elements that we actually use of our emotional life, that we use to compost this seed of Buddhahood that will grow into a beautiful lotus flower. So that's kind of what I wanted to say about motivation. You can read the rest of the slides because I'm trying to save time. There's several things I want to talk about today. Today I want to actually talk a little bit about what is chaplaincy, because give some historical lens. And then I want to talk about the path of how we teach chaplaincy, both at Naropa and in the States in general. And if we have time, I'll talk about how this teaching of chaplaincy, caring for the world, may become embodied in self-compassion, although we've already talked about that a little bit today. So if we don't have time, you can look at my slides or something like that. This is actually a quote. I actually read a lot of chaplaincy books from a Judeo-Christian perspective, and I end up sort of translating them in my mind into a Buddhist perspective because I'm a practicing Buddhist. So a chaplain is someone in a journey with the patients and families. A chaplain is not a fixer or an answer giver. So it's maybe a little bit different in terms of diagnosis, but very similar to counseling that we just spoke about. A chaplain provides a unique presence to patients and families, a presence that allows them to show their deep vulnerability of being human while facing a diagnosis that may lead to terminal illness. Or sometimes it's not illness. I'm trained as a hospital chaplain, but we now have the people like prison chaplains, disaster chaplains. We've had many disasters in the United States, and I know there are many. I'm working with the Japanese monks around their 3/11, their tsunami that they had. So these events of illness or disaster or prison, there is no neat resolution to them. So part of the practice of chaplaincy is to train as a chaplain is to learn how to work with that indeterminacy, actually, and to hold space for that and to understand what that space is, which we might, as Buddhists, say that's the space of emptiness, compassion. So emptiness holds a compassionate activity, but it does not necessarily provide a fix or an answer. So simultaneously would be with patients, family, and I would add our staff, the medical staff, simultaneously with an agenda and without an agenda. So it's a very creative profession, I found. It's not always like, you check. It doesn't always although it incorporates many of the modalities that we've talked about in this conference, the psychological modalities. So just a little bit, the roots of pastoral care are interdisciplinary between religion, spirituality, and human suffering. And typically, chaplaincy has worked at the intersection between clinical care or westernized ideas of clinical care and religious communities, which is exactly what we've been talking about here. Just a few people of history. Anton Boysen developed, and so throughout history, this is not new, throughout history, religious communities and religious leaders, ministers, monks, lay leaders, ordained leaders have always visited people who are sick, suffering. This is not a new phenomena. But in the 1930s, Anton Boysen started developing chaplaincy as a profession right around the same time Sigmund Freud lived, so it was sort of co-developing with psychology. And he talked about observation of people as, his words were the living human document. So it's about observation, which is very similar to what we've been talking about. Observation of the needs, longings, and particularly what is maybe unsaid, what I considered below the fourth skandha. Since we're Buddhists, we can talk this way, sort of the nonverbal, emotional, what we at Naropa might call the felt sense of someone's longing, and it may not be completely conceptualized. So that is part of the practice of being able to listen to that, to hear that, to discern what those movements are, those emotional, spiritual movements. And they may not be expressed verbally ever. We work with people with dementia, with Alzheimer's, there's a question about autism yesterday. So there is caring at that level. And then the other person's, Hiltner, talked about the solicitous shepherd. So this is a Christian analogy, but it's someone who just walks beside, shepherding or walking beside people, somewhat leading from behind. As you know, the shepherds, you're sort of herding people from behind. So you're not always in front with the answers. But also, a shepherd pays attention to not only who or what they are shepherding, but also to the context, to the landscape of things, to, is there a storm? Are there hills? So similarly, we pay attention as chaplains to context. Context always informs how people arise. How do people arise? For instance, since we've been talking about the five skandhas, one of my favorite topics, how do people arise through the five skandhas in particular contexts, different contexts? So I am different here in Hong Kong than I would be with my family in Boston, different from how I am with my students at Naropa. I'm arising differently. I may dress differently. I have different emotional components. I'm trying to think differently. So that's kind of the roots of pastoral care. I think we've talked about that. We talked about spirit being a natural aspect of all persons, and how I actually translate this into Buddhism for myself, because this is taken from a professional chaplaincy document from 2001, talking about chaplains caring for the spirit. So how I think about this as a Buddhist is that we are caring for people's, that seed of bodhicitta. We are caring for that, and we are providing a space for that to grow. So how we discern this includes different beliefs and practices. In healthcare, we care for families, patients, and we've already mentioned a lot of these aspects of loneliness and illness, working with ambiguity. And the care team, the physicians, the nurses, the social workers, sort of are part of the domain of pastoral care. I like to think about that there are three different lenses of pastoral care. So by this I mean you sort of approach any encounter you might have with patients, family, staff, through three different perspectives, and these might be overlapping. You know, it's not that they're completely separate, but the first one, Carrie Doring, one of my colleagues at ILIF in Denver, developed these. One is called pre-modern, which she refers to the care that's accessed through religious rituals, traditions, and spiritual experiences. So care that is typically based in the religious doctrines, practices, rituals of any given tradition. So some people may be comforted by chanting Buddha's name. Some people may be comforted by praying to the Virgin Mary, things like that. Another lens of pastoral care is what she is calling modern care, that includes the rational and empirical knowledge such as psychology and medical science. So a lot of the presentations this seminar have also sort of referenced that perspective as well, the psychological perspective, the empirical knowledge perspective, sort of dividing things into domains of knowledge and procedural kind of modalities that we have in medical care that, that we've presented on a lot. The last lens she calls postmodern. So these lenses are sort of, what do people need to nurture that spirit? What do people need to nurture that bodhicitta? They may need a ritual or prayer, a formal prayer to the Buddha or to Jesus or God or something like that. They may need a psychological support, such as has been talked about this morning, some kind of psychological support of understanding. They may need the postmodern one. The third one is cultural and social identity. So they may need a acknowledgement and then sort of writing of sort of social context and power issues. So they may feel that in the US we say things like marginalized. They may feel marginalized by different groups. They may feel that they're not being treated fairly in certain social contexts. And that actually might be what is suppressing their spirit, their bodhicitta. So these are kind of three different overlapping lenses of pastoral care. There's always a question of, well, who provides this this kind of care anyway? And so typically in the States anyway, and this is an emerging profession. It's not as regulated or board certified as medical care, as social workers, counselors. So there's a lot of movement in terms of what the profession is, actually. But typically in the United States, the chaplain does not necessarily displace religious leaders. So when I was the Buddhist chaplain on call in my hospital in Philadelphia, they would still invite the monks or the spiritual leaders of the person's denomination to come, so the monks would come and chant with a Buddhist patient, and I would be there as well to support them in spiritual care. And chaplains are typically in healthcare, part of the healthcare team. You're often hired by the hospital rather than a particular religious organization. We're trained to meet diverse religious and ethnic needs and cultures. So in the United States, I was trained as what we called an interfaith chaplain. So I was trained, and I'll talk about that just a little bit because it's a whole, 3-year training, but we're trained to actually meet people where they are in different ways. But I also was the Buddhist chaplain on call, so if a patient, if there was a, Chinese or even a Western Buddhist in the hospital who needed Buddhist frameworks care, I was also the person. So what we do is there's members of the patient care team, and I'll talk about what that might be. There's also aspects of ceremonial and ritual leadership. Often hospital chaplains are on the hospital ethics committee, because this is one thing that we think about are the ethical aspects of going through and making choices in a medical care system. And we're often the patient voice. Everyone else has different motivations for interacting with hospital patients, usually to, quote, cure them, get them better, and then figure out what's wrong and then get them better. So the chaplains often end up being the actual voice for other concerns, not just the curative ones, but other concerns that they might have. Chaplains, there's a whole path of what we call spiritual formation, and I always say it's not the first nidana a formation, but it's actually sort of how do you actually mature in your spirituality so that you're actually able to hold these difficult situations and encounters, so that you're actually able to hold some of the ambiguity and not immediately try to fix different aspects of a person's being, because sometimes there is not an easy answer. So there's a sort of a maturing, and at Naropa, and we train our students to actually, that maturing happens through, it's a personal maturing, so it actually happens through a personal practice, so people develop personal practices such as Tonglen or mindfulness, as we've talked about, not to treat people, although that might also be helpful, but also to give you as the caregiver some kind of stability and maturity, to be able to genuinely listen and then discern what might be helpful in any given situation. And we've talked a lot about those steps, but I think the spiritual maturity is very important, because it's not just about doing stuff, check, 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 check. It's about having some kind of stability in your understanding, frankly, of emptiness, compassion. Those are I'm using those words because we've used them already, but some kind of coming to terms with that yourself. So at Naropa, I'm just going to talk a little bit about how we integrate theory and practice. People study the basic Buddhist sutras through the 3 turnings of the wheel. So we're a university based in Indo-Tibetan traditions. So we have they study the 3 turnings, and also different analytical meditations that sort of supporting understanding of emptiness or not interdependence, depending on how you want to look at that. I think we're very big on the 3 prajnas, which is the Sanskrit word for panna. And the way I understand it is that the first one is actually hearing. So we actually hear the teachings, the formal teachings of the Buddha. You study the sutras, the Abhidharma as well, the psychology. But the second one is contemplating. So I always think of contemplating as that, so you hear these teachings, and so we've heard a lot of things today, for instance, or yesterday. And so to me, the way I think about contemplating is that you're actually trying on the teachings. And I always think of it as an analogy of trying on a jacket. So you try it on. Does it fit? Does this teaching fit you? is it too tight here? Is it too loose? Does it work for you? So to me, that's actually a process of contemplation of the teachings, of the Buddhist teachings. Because without that step to make the teachings genuinely authentic for you, they're just, a bunch of words and ideas and philosophies, which the Buddhism has a lot of as well. And then the final step is that you can actually embody them. So we call that meditating. So you can actually carry forth with the teachings. So this is a process that we visit and revisit at Naropa constantly, that we want the students, we want not only the students, the teachers too, to understand what the teachings are and to somewhat embody them for yourself, but also in order to carry them forth, and that's what we're talking about in terms of chaplaincy, and I feel some of the things we're talking about in your, other modalities that have been presented, we need to sort of have an internalized sense of what they are. As many of you know, so I don't know if anyone talked about the Bodhisattva ideal, but as you know, hearing the cries of the world is typically what the Bodhisattva Avalokiteshvara heard the cries of the world. And if you see different images of Avalokiteshvara, there's many arms. So it's said that sometimes Avalokiteshvara has 1,000 arms, and I sometimes think that there's 1,000 or more modalities that we can help people with. So I feel that what we've been exploring here is just, a few of them, obviously. But so there's the aspiration to save all sentient beings. So the aspiration is that the Bodhisattva vow is that I will not choose my own enlightenment until all sentient beings, and it's not just human beings, it's sentient beings, are liberated. So that's the aspiration. And then to actually put that into practice are the teachings of the 6 paramitas, which are very beautifully written about in Shantideva. And I think we've talked about Shantideva today and yesterday. But basically, there are the paramitas. There's 5 paramitas of what are called upayas, or skillful means. So that's actually what I consider the behavioral aspect. How do we carry out this vow through generosity, through exertion, through patience, meditation, discipline? But then there's also the paramita of prajna. So this is the understanding of emptiness, of interdependence, that has been beautifully spoken of this program as well. So these two go hand in hand. Prajna and upaya go hand in hand. They cannot exist. If you have too much prajna, it's just very theoretical. Too much upaya is just doing things. So they're paired as co-emergent wisdom, co-arising of things. So I just wanted to say that in clinical encounters, I feel there is a felt experience of bodhicitta. So we've talked about, this bodhicitta, or my teacher called it our basic goodness. I think of it sometimes as basic humanity. So we can actually experience that with one another when we meet each other. So I've experienced that here a lot, but often in clinical encounters, we might explore what that might be for different people. And since I'm trained as an interfaith chaplain, sometimes that connection between sort of that heart-to-heart connection is through an understanding of Buddhism or spirituality. Sometimes it's a heart-to-heart connection of what's your family like, Sometimes it's a heart-to-heart connection about the sports team of Philadelphia, which the Eagles, which, so sometimes it's a heart-to-heart connection of many different things. So it's an exploration and willingness to see that bodhicitta is resident in all sentient beings. It's a matter of finding where that seed is and bringing it out and cultivating it. The bearing witness aspect is actually the other, and this has been spoken of many times by Joan Halifax and others in the Zen tradition of really not knowing. So you go into these situations, and often I was called as a chaplain in a hospital, so you didn't have the time to actually do intake with people or anything like that. So you just go with a sense of not knowing what you might find, but giving that space to that. It's not about not a blank mind, but just having space to accommodate. Bearing witness is actually being willing to see what there is to see. And sometimes that's very sad, so your heart might break. People in hospitals in general are very ill. So, and then there is the action that comes from understanding people's longings and even how they frame those longings. What words do they use? Since the United States, we have many different kinds of spiritual practices. So kind of what view do they have and what words do they use? I'm only there to serve the patient and their family. And it took me, I have to say, I share this with my students, it took me about a year to learn how to pray the Lord's Prayer in that genuine way, to say, and in Jesus' name we pray. I'm not praying for myself, I'm praying for them. And if those words make them feel comfortable, then, it's that. So, so I think I just talked about that. So let's see, let's go. So I wanted to talk a little bit about stepping into the person's world. And I really feel that part of the practice of pastoral care, actually I'll go back one, is what is a person's, what we call lived theology. And theology sort of being a broader way of how do people make meaning in their lives. So there's actually an investigation of that. And then we investigate what is life-giving to people. What opens people up? What opens their heart? And also, what is life-limiting? What is shutting down? And so it's similar to a little bit of intake that we've talked about in terms of the counseling, but it's also framed in terms of one's spirit, because the chaplain is caring for the spirit of the person, however they think about that. We're caring for their spirit. So how does the spirit shine? What words, what meanings, and how is the spirit shut down? And then how do, these religious, psychological, and social systems create this living theology, You can analyze it through the skandhas or however, but how does that happen? And so we have this idea of reflexivity, so which means that there's a reflexive aspect that we actually inquire, and then there's some information coming back, and then we inquire again. So it's reflexive. We're reflecting and also bouncing back upon beliefs, because beliefs, one's internal beliefs, this gets into the ethical systems, determine what values you have. So the values are actually kind of how you think about, okay, I want to do this or do that. So Values are a little bit what we might call operationalization of beliefs. And then that actually, your values influence your behaviors. And this goes to anything, these are basic ethical principles, but it goes to, decisions around care, decisions around treatment of depression, for instance, as in our previous presentation. So we want to integrate the values and sort of what I'm calling the theological values. So how do you make meaning in your life? You want to integrate those beliefs, and they might be doctrinal in terms of Buddhism. They might not be. They might be Christian beliefs, I don't know, Sufi. We have all kinds of things at Naropa. How do those inform preferences, values, and then how do those preferences and values embody how people go forward in their lives, how they actually live their life out, And so the other thing is that these lived theologies are often held together. They're often rationalized by our emotions. For instance, of guilt, shame, fear. We rationalize how we live our life through our emotions. And this is basically basic counseling principles of trust needs to be in place before anyone can explore them. So that trust for me always is acknowledging that simple heart of bodhicitta, that, finding out where that is and allowing that to be there. I think we've talked a lot about these themes, and not only in pastoral care, but in counseling of transition. I want to say that some of these losses, though, we've talked about them being experienced personally and relationally, but also communally. So communities can experience loss as well. So I actually worked a lot with immigrant communities in Philadelphia. So, there's a certain dislocation that happens when you are in that kind of community. So these are just some of the themes of pastoral care. We've talked a lot about that already. Want to say just a few things about how we, our program at Naropa, and how we're collaborating with other Buddhist chaplaincy programs in the States. So we have a Master of Divinity program, which is a 72-credit program. And, our students go into, about half of them become hospital chaplains, but many of them they run meditation centers, they become prison chaplains, they become, one of my students right now is very interested in becoming a disaster chaplain, or we work with environmental chaplaincy, because our environment, if you think about Mother Earth as something that is a phenomena that is needing care right now, our environmental and ecological Earth is needing a lot of care. And so there's a lot of different things that people do with this degree. We base it in our Buddhist, going backwards. So here's our, this is the most detailed slide I have. But this actually just describes all the courses that we have. And we have the PLOs, it's an acronym for Program Learning Outcomes. So we have these 4 learning outcomes. One's around their identity, a theological identity informed by Buddhism. One is, we actually, similar to how people meditated in your social work practice, we have courses on meditation. So we actually have 3 meditation practicums. The first one is basically shamatha vipassana meditation that we spoke about yesterday. The second one is analytical meditation, where people actually learn how to use logic to deconstruct that sense of being. The third meditation practicum is based on Atisha's slogans, which is about compassion and taking that emptiness and relative and absolute bodhicitta principles into action. So, so those are our practicums. Our theological study is based on the three turnings. Mind and Its World is it's our Abhidharma course, and then we have a contemporary American religion. So because 80% of the population in the States is Christian, and there's a lot of multiple faith belongers in the States. So people really need to be up on that kind of thing. Communication and formation is actually learning how to be in different contexts. So I just finished teaching the communications course. It's sort of combination of some of the principles we talked about here, as well as things like nonviolent communication, conflict and diversity, interreligious dialogue. So that's how are you sort of shaping your beliefs, values as a student to be a chaplain within the context of, spiritual practices in the States. We have integration labs, which are more like process labs. Then we have our applied courses, which are more specific to chaplaincy practices. So there's a pastoral care course, which some of the slides are, that I showed are from that. There's Dharma talks and religious education, people learning how do people mature in their religious understanding. This is based on sort of, the MDiv program was originally actually a ministerial training, so we can borrow that word from the Christians, I consider it to be spiritual leadership. So, sometimes you must give Dharma talks. In the hospital, I gave talks. They always wanted to have in-services on Buddhism there. So ritual arts is sort of how do we invoke the sacred? Because every encounter in the hospital is actually a moment, an opportunity to invoke the sacred, even though it might be, there's all this equipment laying around or whatever it is. So what is the sacred, and how do we embody that, and how do we recognize how to invoke that? So that's kind of a really great exploration. I mean, it's not just through liturgy, although liturgy is important. Liturgy and prayers are good, but there's also other things. So those are some of our applied courses, what we call the practical theology or applied courses that we have. We also have a Buddhist ministry working group. So our working group is it's a yearly gathering of the Buddhist MDiv programs in the States. So this Harvard, University of the West, IBS in Berkeley, Maitripa up in Seattle. There's a few Buddhist MDiv programs plus, Upaya Zen Center and the New York Zen Center for Contemplative Care. So we meet every year. We just we compare our syllabi. We're actually working, there's a few of us, I'm on that committee, that we're working with the Association of Professional Chaplains, which is in the United States, the organization that board certifies chaplains. So we're working with them because they're very interested in Buddhist chaplaincy, and they're also very interested, partly I think because of the mindfulness work that's been presented here, in this program. So we're working with them to reframe and, sort of re-language and explain to them, like, what is a Sangha, things like that. So here's our picture from, we were at Upaya Zen Center last year. There's just a few of us there, mostly all of us, actually. And these are some of the things that we talk about. So, we talk about, well, what is right livelihood? what are our Buddhist foundations? What do we, what is foundational to Buddhism? And I really appreciate the dialogues we've had here today because, we've explored that. Is there a particular Buddhist way of knowing things? So is there a way that we kind of recognize phenomena that's different than maybe, other traditions? And that's a question. These are all questions. I don't say that they have one answer. And what are our different paths as Buddhists? And how might these paths be articulated? How can we show up in the world? And of course, what is the common ground that we share as institutions? So we're always thinking about that. We were just, the American Academy of Religion was just in Denver a couple weeks ago, so we met there and we tried to, there's actually quite a few, there was one session on chaplaincy and there were quite a few people who were Buddhist chaplains, So, yeah. So maybe I'll stop there. How am I doing for time? Like what's... Yeah, so I have some slides on self-compassion and moral injury, but I feel that we've kind of talked about that a little bit, and if you'd like to talk to me afterwards, I'm fine about that. But maybe we could instead take this time to have a few, if there are any questions or comments you might have about what I've presented so far.
I noticed that in your PowerPoint, you mentioned Naropa's methods. But Naropa is a famous yoga master, and then he's 6 tantra yoga tantras. So which of these 6 do you use?
Oh, you mean which of the 6 yogas of Naropa do we use? Our institution is actually named after the Mahasiddha Naropa, who was a great scholar, and also the story that we like to tell our incoming students is that he was a great scholar, academic at Nalanda University, which was a very well-known university in India in his time, and so he was an academic, and he was visited one day by a Dakini, who was an old woman who was sort of a spiritual messenger, and she asked him, do you know the words of the teachings? Do you know the words? And of course, he was very studied. He had studied all of the Tripitaka. He had studied all the sutras. And so he said, yes, I know the words. And then she said, do you know the sense of the words? Do you know the authentic meaning? And then he said, yes, I know the meaning. And at that, she became very disappointed and very angry at him because she challenged that even though you might know the words, what is sort of the first turning, the first prajna, the words you've memorized, you've kind of, the words of the teachings, the meanings of the teachings are sort of a lifetime or many lifetime path. So she became very angry with him and said, you don't know the meanings. And so that actually inspired in Naropa to give up his post as an academic and go on this journey. And one of his root teachers was Tilopa, who was another Mahasiddha who was a fisherman and also a pimp, a prostitution pimp. So he was more of a crazy wisdom person, but that's who Naropa took for his spiritual teacher. So we're named after that because we aspire, and I must admit it's a very humble aspiration, we aspire to have both teach the words, but also to set students on a path of exploration of what is the meaning, the authentic meaning of those words. So we actually, our little logo at Naropa, which is a Dharma chakra, underneath is in Sanskrit prajna garbha, so meaning the womb of prajna, the womb of wisdom, the womb of knowing. So we see ourselves as a gestation place for that kind of thing. Yeah. So, one other
I
question?
think maybe this is the last question then. Thank you.
It is a beautiful discussion here. I would like to know a little bit about how it applied in Hong Kong, because it's almost like a medical social worker and a very liberal Sangha in any community. I mean, I see your experience. Maybe we could actually see how we can actually do it in Hong Kong. It's a lot of self-help ideas I see in your presentation.
Yes, yes. And I know there's a panel later today, is that right? On chaplaincy, and I know you have some ideas about how this might happen here. So I'll be there, and I'd be happy to talk more specifically about, how there's all these professional competency. There's a whole thing about it, but then there's the framework for it, and then there's also the question of how to actually teach this and how to make it come alive here. So those are two different things. Yeah, thank you. Thanks.
Thank you very much, Professor Yuen, for a very beautiful presentation.